Chairman Sanders, Ranking Member Graham, and members of the committee, thank you for the opportunity to testify before you today. My name is Dr. Abdul El-Sayed. I trained as a physician and epidemiologist and served the city of Detroit as health director, where one of my responsibilities was rebuilding a health department that had been shut down during the Great Recession. Today, I teach at the University of Michigan's Ford School of Public Policy. There, I find myself explaining the haphazard dysfunction of our current healthcare system to some of the brightest young minds in the country. What's a deductible? Well, it's like having to pay an extra $19.99 to watch a movie on Netflix that you thought you already paid for. Only this time, it's for your basic healthcare needs and it's thousands of dollars. They remind me how much nonsense we accept as normal in our healthcare. It's partly why I recently wrote a book on the very subject, Medicare for All, A Citizen's Guide with Dr. Micah Johnson, and I furnished a copy to each one of your offices. I want to start with the two most obvious problems in American healthcare: incomplete coverage and spiraling costs. To understand them, I want to correct a basic misunderstanding of how we approach healthcare in this country. We like to think of ourselves as consumers, as customers, but we're not. Let me just share how being a customer works, just to review. Let's say you want some tomatoes. You go to your local farmer's market, you find a stall with some you like, you ask the seller for the price, and if that price is too high, you walk away. But if it's good, it's fair, you buy, you tender your payment, you get your tomatoes. That is a normal customer experience. But healthcare is not that. If I were to have a heart attack right now, in this room, I'd be rushed to the nearest hospital with no choice of what hospital I go to. I'd have no choice of what doctor I see, what treatment I get. No one shows me a price list, and I have no opportunity to just walk away if I don't like anything. I'm having a heart attack after all. Afterwards, a bill is not sent to me. It's sent to a third party, my insurer. And rather than being the initiator and completer of a financial transaction, I'm the reason a financial transaction happens between my insurer and my provider. So ask yourself, given the usual customer experience, are we as American healthcare consumers, are we the customers or are we the tomatoes? Healthcare is simply just not a market product. The health insurance industry assures that. You might expect insurance companies to want to negotiate healthcare costs downward. After all, they are the payer, but they don't. It's one of the unintended consequences of the so-called 80-20 rule, requiring health insurance companies to spend at least 80% of what they collect on premiums in healthcare. After all, ask yourself, what's the best way to grow your 20% piece of the pie? Make sure you got a bigger pie. So they make the pie bigger and they pass those costs back on to us in the form of premiums and deductibles. Premiums have risen faster than inflation and wages over the past decade, and deductibles have more than doubled, and those are dangerous. One study found that high deductibles was associated with a 9-month delay in getting treatment for breast cancer. The operative part of the word insurance is supposed to be sure. But in our for-profit system, you can't really be sure of anything. And those are the first-class healthcare citizens. There are, of course, the second-class healthcare citizens. Over 100 million of them, 28 million who are uninsured, 87 million who are on Medicaid, a critical but underfunded lifeline program. Medicaid reimburses far lower than private health insurance, so a lot of providers just don't accept it. Now, here's the thing. Reimbursing the same exact healthcare services at lower rates reflects an implicit lack of value of the body for which that healthcare is being provided. You cannot deny it. And those bodies in this country are disproportionately black and brown, disproportionately rural. Meanwhile, the prices keep rising. Corporations keep making money when they do. And we spend more than $12,000 per capita per year on healthcare, more than twice as much as our counterparts in Canada. They live 4 years longer on average, by the way. In the pandemic, it demonstrated that coverage and costs aren't our only issues. Early on, healthcare workers struggled without ventilators or beds or basic PPE. 27 million Americans lost their employer-sponsored health insurance with their jobs. Local and state health departments and the CDC struggled under the weight because they were already anemic from the disinvestment during the Great Recession. So despite the need for more beds, 21 hospitals shut down in 2020 alone. That's including 73 over the past decade, 4 in Senator Graham's South Carolina alone. But guess what industry had a banner year in 2020? The health insurance industry. They got to keep all of the money that didn't get spent on elective procedures, which, by the way, are why those hospitals shut down. American life expectancy dropped 25 years, dropped by 3 years, wiping out 25 years of growth. So what did we learn? Even with private insurance coverage, it's not durable. It's liable to be lost to you, precarious, as we saw in the pandemic. American consumers are losing their healthcare choices through hospital closures and mergers and acquisitions, which, by the way, allow large healthcare systems to exploit workers, including nurses and doctors. And we're failing to invest in public health. Now, the genius of Medicare for All isn't just that it solves coverage and cost. It's that a universal national health insurance program for everyone offers a solution for each of these problems. Medicare for All is the clearest pathway to universal, durable healthcare insurance, bar none. Cradle to grave coverage would do away with the premiums, copays, deductibles that leave even privately insured Americans rationing their healthcare today, just like they do every day in America. Medicare for All would expand healthcare choices by limiting hospital mergers, acquisitions, and shutdowns that threaten those choices, and empower mammoth healthcare systems in the process. It would also empower healthcare workers. And it finally addresses the misincentives that we have to invest in prevention and public health. So to conclude, opponents of Medicare for All are going to tell us all of the same fear-mongering arguments we've actually already heard today. They're going to say that Medicare for All would eliminate healthcare choices, but really it is critical to preserving the choices Americans actually care about, which are the choice of doctor, the choice of clinic, the choice of hospital. They'll say we can't afford it when American families cannot afford the system that we have today. What about innovation, they'll ask? Well, providers stay private under Medicare for All. Never mind the fact that our federal government is the most important funder of biomedical research in the world. But rationing, what about rationing, they'll say? Well, out-of-pocket costs are forcing Americans to ration healthcare every day in the current system. They'll tell us that Medicare for All is somehow un-American. But what really is un-American is staring at our broken healthcare system in the face while it's breaking people in the process and choosing to look away. Today, you're choosing to stare it in its cruel, indifferent face. And I commend you for doing this. And I hope that I've offered some insights into how and why it's broken and how Medicare for All is the solution to fix it. Thank you.